welcome back to another episode of Hona Mids, powered by R.A. Williams. I'm your host, Janelle. So, when you think of the NHF or the National Health Fund, you usually think of a card that allows persons to access medication at a reduced cost. But the National Health Fund is much more than that. And today, here to tell us more about the NHF is their CEO, Mr. Everton Anderson. Hi, Mr. Anderson, welcome.
Hi, Janelle. My pleasure to be here. I hope you're well.
I am good. It's a pleasure to have you. How are you feeling today?
I am good.
All right, so let's jump into the first question. What is the NHF?
All right, so the National Health Fund, the NHF, was set up in 2003. And this followed decades of discussions around national health insurance for Jamaicans. And the NHF is what emerged from those discussions. And the NHF Act came into being in 2003. And that led to the NHF providing a number of offerings to Jamaicans, mainly subsidies on medication through the NHF card, health promotions to Jamaicans through the ministry and through the regional health authorities. Included in that is also capital funding, and in the later years of NHF, the provision of pharmaceuticals to the entire public health system and medical sundries.
Oh, that was a mouthful. So it does a lot for Jamaica. It does a lot for our country in terms of accessing medication at an affordable cost.
Yes.
So how does the NHF partner with distributors like R.A. Williams to help persons access these kinds of medications at an affordable cost?
All right, so we're really one of the main hubs in terms of providing essential medicines through the public health system, as well as to all Jamaicans. So through our public tender, we provide all the medicines used in all the hospitals and clinics. And R.A. Williams is one of our distributors, along with several others. We also get medicines from manufacturers abroad directly. And each year, about 700,000 Jamaicans benefit from these medicines in all the hospitals throughout Jamaica and through the health clinics. In addition, through our subsidy programs, pharmaceutical distributors provide medicines to over 450 pharmacy providers, and these providers then pass on these benefits to the NHF beneficiaries. So it's really a very close relationship we have with distributors that enable Jamaicans to access medicines with fairly ease of access.
That's good. I think everybody should get the chance to access affordable medication.
Yes,
and I'm so happy that you're here because 700,000 persons, that sounds like a lot.
Yes.
All right, so you mentioned 700,000 persons. So tell me, how many therapeutic areas does the NHF cover?
All right, so when I speak about coverage, I'm going to speak about two sides.
Okay.
So on our NHF card program, we cover 22 conditions. And this has grown over the years. We didn't start out at 22, but we are at 22. We recently added a number of conditions, and we try to cover the essentials, the hypertensive patients. We cover diabetes, asthma, cancers, among others. And the aim is really to significantly reduce the cost, the out-of-pocket payment to patients. In fact, since inception, the NHF has saved Jamaica's 60 billion in terms of subsidies. Because think about that, 60 billion in subsidies since the setup of the NHF. So people would have had to find these monies from their pocket or would have had to give up on other essentials in order to be able to afford their medicines. On the other side though, which is the public health side, we literally cover all disease conditions in terms of the medicines that we provide. And these are provided free of charge to the patient. And on this program, we have spent since the takeover of the pharmacy services some 80 billion in providing medicines to Jamaicans. So the impact of the fund is really, really good in terms of how we reach the average Jamaican person.
So I have a follow-up question. Can we go anywhere and get the card? Can we go to different parishes and get the card?
Yes. All right, so that's a very interesting question because years ago we had a system where we had our head office and you could get the card there, and other persons would apply and we mail the cards to them. But we are an organization that believes in always making things better and improving access. So we've set up card printing locations in every single parish. So whether you're in Westmoreland, St. Thomas, Portland, St. Anne, you can get your NHF card at our locations within 15 minutes. So we also prize ourselves on being able to deliver a very good service experience. So you can get that card within 15 minutes in any parish in Jamaica. In addition, through our online registration system like doctors, you can get the card through your doctor, just sending in through our virtual platform and pick up at an agreed point.
Right. That's very impressive. So I see you wearing a 20th anniversary shirt. Congrats on 20 years. That's not a normal feat. So how has the NHF evolved since then?
All right, so the fund started out very slow because a public body would take time to grow, but we've seen the NHF evolve into a very large organization. We started with provider uncertainty. Pharmacists were not sure they should join up with this organization.
Because it was new.
It was new. We now have over 450 pharmacy partners right across the country, and we work very closely with these providers to deliver the benefit to Jamaicans. We started out with 30 employees, and we're nearer to 900 employees now. And just look at the transition in terms of the work we're doing. It's something that is remarkable. We started just with the NHF card in 2003. A year later, we added the JADEP program to NHF. So JADEP is the Jamaica Drug for the Elderly program. It's a program that is targeted to our beneficiaries over 60 years of age. The NHF further grew in 2011 when the agency took over Health Corporation Limited and took responsibilities for procuring pharmaceuticals and medical sundries for the public health system. We then moved to take over our public health pharmacies, and we now manage over 106 pharmacy locations. And we've seen a tremendous growth in the organization, the NHF card, in terms of what it delivers and what it provides. And just to summarize it, we've spent 80 billion on drugs and medical sundries for the public health system. We've spent another 60 billion in subsidizing medicines. And one of the things I didn't mention earlier is that we also provide capital support to the public health system, and we've actually done over 850 healthcare projects, spending 22 billion on these healthcare projects, and this would include equipment, elevators, and one that we're actually very proud of because we also manage that project, which is setting up 2 cancer treatment centers, one in Montego Bay and one in Kingston. So the fund has grown significantly, and we are committed to doing the best we can do for Jamaica and we love.
Happy to hear. So it's so much more than just a card. It covers so many other things. All right. So where do you see the NHF 20 years from now?
All right. So in terms of visioning, I would probably want to go back to where it all started. I mentioned at the start of our discussion that the NHF was formed out of decades of discussing health financing and national health insurance plan. So we did our own internal visioning exercise, and I think what came out is that most persons would want to see the NHF be a lead organization in providing a platform for that national insurance coverage that we want to emerge, which would mean that persons have ready access to health care and that financial barriers would be significantly reduced. So that would be our long-term vision.
That sounds awesome. I'm sure with the impressive track record that the NHF has, you guys will achieve that and then some 20 years from now. Thank you so much for coming, Mr. Anderson. It was such an having.
It was my pleasure, and all the best to you and the Ari Williams team.
Oh, thank you so much. There you have it, guys. I'm sure that you learned a lot about the National Health Fund. Tune in next time, and until then, go and hold a bit.